Most people think about cranberry after the burning, urgency, and discomfort has already started. But that is exactly where cranberry gets misunderstood. Cranberry is not an antibiotic, and it's not just a treatment for an active urinary tract infection. Its most interesting role is actually prevention, especially for people who tend to experience recurrent UTIs. As a naturopathic doctor, I often explain it this way. Cranberry does not work by killing bacteria. Instead, it contains natural plant compounds called type A proanthocyanidins, or PACs. These compounds may make it more difficult for certain bacteria, particularly E. coli, to attach to the lining of the urinary tract. If bacteria cannot attach as easily, they may be less likely to settle in and multiply. Think of it as making the bladder wall a little less inviting, not exactly a 5-star bacterial resort. Now, this is also why the type of cranberry product matters. A glass of cranberry cocktail may contain a lot of sugar and an unpredictable amount of the active compounds. A standardized extract gives you a more consistent dose without having to drink a large amount of acidic juice every day. This is the kind of product I would consider for someone who is looking for ongoing urinary tract support, rather than waiting until symptoms appear, hoping that cranberry juice will just fix the problem. And consistency really matters. Cranberry is not usually a take it once and feel it immediately kind of supplement. It is used regularly as part of a prevention strategy. That strategy should also include drinking enough water, not holding your urine for too long, urinating after intercourse when appropriate, and addressing factors such as vaginal dryness, blood sugar balance, or incomplete bladder emptying when they are relevant. Most importantly, if you have burning, fever, back pain, blood in the urine, or symptoms that are getting worse, do not rely on cranberry alone. An active UTI may require a urine test and medical treatment, and kidney infections are not something to casually negotiate with. Cranberry may be a useful tool for recurrent UTI prevention and urinary tract support, but it works best as part of a complete plan, not as a replacement for appropriate care. People taking blood thinners or those with a history of kidney stones should also speak with a healthcare practitioner before using a concentrated cranberry extract. Comment down below, have you ever used cranberry for urinary tract support? And did you use juice or a capsule? If you've enjoyed this video, please make sure to like and subscribe. Thanks for watching, and I'll see you in the next one.